Kwekwe, Unusakut, Tanse. Hello, bonjour. I first want to acknowledge that as we are in Ottawa, I'm speaking to you from the traditional territory of the Algonquin people. I'm joined here today again with Chief Medical Officer Tom Wong, Indigenous Services Canada, and Associate Deputy Minister Valerie Gideon. Tom will offer some words after me.
As of February 4th, nearly 1.2 million Moderna and Pfizer vaccines had been distributed in Canada. As of February 9th, 344 Indigenous communities were being vaccinated in the provinces and territories. That is over 72,000 doses that were administered to Indigenous individuals in these communities. Planning our vaccination rollout in cities also remains a priority. We are in regular discussions with Indigenous organizations at the national and other levels. We are in discussions with municipal, provincial, and federal health experts as well. Vaccination centers are already open in Indigenous communities. This work must continue, and our objective remains the same. By the end of September, we aim to provide every Canadian who wants it the chance to be vaccinated. Despite the reduction in doses sent, the vaccine rollout has entailed significant work, innovation, and improvements, especially in Indigenous communities.
The population is comprised of Indigenous peoples. Close to 17% of the population has received at least the first dose of the vaccine, compared to a little over 2% of the Canadian population. And in the territories, we are still on track to vaccinate 75% of the adult population by April. In Manitoba, First Nations are working with the province to determine vaccine allocation, and with input from First Nations, the province has announced that traditional healers and knowledge keepers living in urban areas or off reserve will get vaccinated shortly. These healers have been an important source of support for the communities throughout the pandemic, helping people suffering from COVID-19. As part of their work, they are exposed to the virus at high rates. And it's in keeping with Indigenous culture that the elders, knowledge keepers, be cherished and protected, whether they live in community or not. In Ontario, Operation Remote Immunity continues flights to 31 Anishinaabe Nation flying communities to vaccinate adults. The work will continue over the next 3 months, and I want to thank everyone involved in that operation, including the Canadian Rangers leading this operation and helping out. The effort has had some tremendous success. For example, one of the communities that Operation Remote Immunity has visited in Muskrat Dam has reached a 96% vaccination rate for adult residents.
In Quebec, vaccination programs are underway in Cree and Atikamekw communities. Healthcare workers and people living in senior care homes have been vaccinated in 17 First Nations. Quebec's plan is to vaccinate all First Nations communities by March 31st. In spite of this progress, some challenges remain for Indigenous communities.
Are great signs of progress being made. There are still challenges facing Indigenous communities. For example, in northern Manitoba, the military will assess Pangasi First Nation following a major outbreak in the community. 18 rangers are now supporting the community with logistics and wellness checks. They're also delivering goods and medical supplies. There's another issue that I do want to address today, which I've spoken to before, but I feel is important, so I'll speak to it again. There's been a pushback about Indigenous community status as one of the priority groups for receiving the COVID-19 vaccine. Regardless of where you call home, Indigenous peoples are 3.5 to 5 times more at risk of suffering severe, even life-threatening consequences of COVID-19. It's why the National Advisory Committee on Immunization has identified Indigenous people as a priority for vaccination. Canada, we are a country that cares for its vulnerable, so I hope with this knowledge, people will accept this strategy and implement it. On First Nations reserves, as of February 9th, we are aware of 1,761 active cases for a total of 18,356 confirmed cases of COVID-19 and tragically 194 deaths. I know this pandemic seems never ending, and it's taken a toll both for those who've been directly impacted by the virus as well as others whose lives have been disrupted. These are the times to help one another, help your family, help your friends, and help your community where you can. And when you need, don't be afraid to ask. Throughout this challenging time, Indigenous leaders have been shining light, supporting and encouraging their people. They've also been helping people like me know what works best in their communities. So I want to thank those leaders, and especially those working on the front lines. And I look forward to the time when we can meet in more normal circumstances.
To help things get back to normal, everyone must continue to follow the advice of our public health experts. Please, everyone, follow social distancing measures, wear a mask when you go out, and above all, wash or disinfect your hands often. Our community to Indigenous communities is firm. I believe that with the incredible support of communities across the country, this pandemic will soon end once and for all.
We are continuing to see positive signs that the curve is beginning to bend. The rate of active cases in First Nations communities in Canada has decreased by more than 50% over the past 3 weeks. Cases of COVID-19 variants of concern are present in Canada, and data suggests that these variants are more transmissible, which pose an increased risk of outbreaks in high-risk populations and communities. This includes congregate living settings, Indigenous communities, remote and isolated settings. In order to reduce the spread and prevent outbreaks, we must double down on public health measures, such as hand washing, wearing a mask, avoiding gatherings, staying home if we feel sick. As of February the 8th, over 72,000 COVID vaccine doses have been administered in 344 First Nations, Inuit, and territorial communities, reaching 12% of the population vaccine dose target at a coverage rate that's 6 times that of Canada's. There has been great leadership in prioritizing Indigenous peoples in regional vaccine rollout. For example, First Nations in Manitoba are working with the province to co-plan how vaccines are mobilized in the north as well as in the south. An immunization clinic is being opened up in Winnipeg for Indigenous healthcare workers, traditional healers, and knowledge keepers. Indigenous Services Canada is working with the Public Health Agency of Canada and the Canadian Armed Forces to support community vaccine rollout. We will continue to work with PTs and Indigenous partners to address human health resources and surge capacity needs as vaccine rollout moves into the next phases. Nous avons besoin.
We need the help of provinces and territories to co-plan with Indigenous partners and to prioritize Indigenous communities in high-risk areas, including the poor and disadvantaged urban areas. I would like to express my gratitude to Indigenous partners, to community organizations, and to people on the front lines who are working around the clock to make communities safe.
Miigwech, Nakumik, merci, thank you, and merci.
Merci à vous deux. Nous allons maintenant.
Thank you both. We will now answer journalist questions. One question, one follow-up.
The phone operator, over to you.
Thank you. Merci. The next question is from, la prochaine question est de Dylan Robertson from Winnipeg Free Press. Please go ahead. À vous la parole.
Hi there, Minister. I just wanted to hear from you a bit more about Pangasi First Nation in Manitoba. We're hearing from Nikki Ashton that the chief is concerned about the lack of road access, that the military has to use helicopters to bring supplies from the airport in the neighboring community, and that the winter road is delayed because the clearing crew caught COVID. So I'm just wondering if you can get into, the extreme isolation here, if that's hampering the COVID response, if ISC is doing anything to get the winter road opened, and if you're planning for something, more permanent, like advocating for access for an airport for this community.
I'll let Val perhaps answer as to the state of the winter road. If we have that information, we get daily updates on the state of the winter roads. It's a particular concern this time of year, and it's one area where the cold actually does help. And you know, sometimes it depends on whether the determination is made to allow in half loads or full loads. Clearly, when it comes to the military, roads are not an impediment. It obviously helps because it's less of a logistical challenge. But you know, if those concerns as we mobilize in are all part of the planning that takes place at the front end of things, Dylan, as we plan resources and as we do those initial reconnaissances to see where and how assets will get in and how that logistical deployment will take place. You asked a question about longer term challenges, and I think these are issues that we're all facing coming out of COVID. But I do take note of them because it is a frequent reminder of where we need to go as we emerge out of COVID, and ensuring that we have the proper infrastructure supports to help communities that do find themselves in a pretty remote location like Pangasi. But Val, if you have any more information on the crew or on the crew for the road, please go ahead.
Well, what I can give you, Dylan, is an incomplete answer, but we do have about 40% of winter roads in Manitoba that are open to light, partial, and full roads, and we've seen an increase of about 15% over the last couple of days in terms of the openness of the roads. We know that we did have a call with Pangasi and a reach out yesterday, and both the Canadian Armed Forces and the department are working in collaboration with the community. What was noted is the importance of having more local support from community members to help support the operations, but we can follow up with a more detailed response with respect to the winter road situation.
Thank you both. And I just had another question for Dr. Wong about variant sequencing. I'm just wondering if the NIB has any sort of a protocol when it comes to screening for variants, or if this falls back on the provinces, or if it's something kind of in between where, you know, you arrange with the provinces to make sure that the variant screening and the actual sequencing as well, if that's, you know, including the FNIB communities.
Yeah, thank you so much, Dylan, for your question. Yes, indeed, we work with both the National Microbiology Lab and the provincial laboratory. This is a network of the laboratory system in Canada in order to detect for variants, just like you know, any other place in Canada. So, thank you.
Thanks, Dylan. Operator, next question, please.
Thank you. Merci. The next question is from La prochaine question est de Christy Kirkup from the Globe and Mail. Please go ahead. À vous la parole.
Hi, good afternoon. Just to follow up on Dylan's question regarding Pangasi, there has also been the suggestion that an individual in the community needed to wait some 17 hours to be medevaced out because of the challenges that have been flagged with regards to the lack of an airport. Minister, I'm just wondering, you know, is 17 hours an acceptable time period for someone to have to wait for emergency services to be removed from the community during this crisis?
Nope.
Christy, do you have a follow-up?
Sorry, Minister, just caught off guard. Would you like to expand on that answer as to why it's not acceptable? And also just adding in a question for Dr. Wong on the variants. You recently spoke about the alarming situation of COVID-19 cases in a number of communities. How would you characterize the threat of the variants at this particular time to the existing emergency that exists in communities?
I see you got 3 questions in there, Christy, but I think I'm not in the business of allowing or disallowing. I think they're excellent questions. I think we should answer them. But I'll be just as brief. People can die, and time is of the essence. It's everything that we talk about every morning in all our calls with our teams, as well as the coordination calls that we have with the armed forces. We need to move now, move quickly, and wonder how we can move quicker every time. The reality of a remote community is such as those risks are there. It doesn't mean we can't. We can't factor those in how we react, and 17 hours is just too long to wait.
Thank you very much for the question on the variants. The more variants there are in the rest of Canada, the higher the potential risk of the potential spread into Indigenous communities. One of the things that's so important, is to double down on all of the public health efforts, avoiding crowds, washing hands, and making sure that we don't go out when we are sick or when we are told to be isolating at home. Those are so important. Those are the measures that can shut down and shut out the virus, whether they are the new variants or not. In addition, of course, we do have the vaccines, and in the future we are expecting more and more vaccines available in Canada. So vaccine is another layer of defense against this virus. And of course, your next question, maybe, well, we have heard that, some of the vaccines may not actually work as well against the variants. However, there are current vaccines that actually have evidence that it is effective against the new variants. The higher the uptake of the vaccine, the more protection we can offer to communities in the coming months. Thanks.
Thanks, Christy. We'll take one more question over the phone and then take questions from the room. Après cette question, on va prendre les questions dans la salle.
After this question, we will take questions from the floor.
Thank you. Merci. The next question is from, la prochaine question est de Jacques Vechera de Please go ahead. À vous la parole.
Thank you very much. Minister Miller, you mentioned right at the top of the conference about some pushback towards the prioritization of Indigenous peoples as a priority group for vaccination. Saskatchewan released its Phase 2 vaccine rollout plan yesterday. It's sequenced largely on age, and it doesn't include any references to urban Indigenous communities, but I know it's been a priority for you. I'm wondering if you're aware of that plan, if you've engaged with Saskatchewan's government about maybe explicitly including urban Indigenous groups, and ultimately what you have in your power to do about it.
Yeah, it is an excellent question. I think it goes back to the basic issue that we've been trying to approach the pandemic with, is let's have a health response to a health problem. It is scientific fact that Indigenous communities, the Indigenous peoples, are more severely affected by these respiratory type diseases, and it's measurable whether you look at the CDC data, our data, more recent data, and its impact on the healthcare systems. We've seen it in Winnipeg, and some of the numbers coming out from Manitoba. It's uncontrovertible to fact that if you are Indigenous, and we're getting into very painful subjects, but your life expectancy is lower. The outcomes, social determinants of health are such that you are negatively impacted. And I haven't gotten into the way the health care system treats Indigenous peoples. Doesn't matter where you live, it's going to hit harder. And the thing that goes against that is inaccurate, perhaps conjecture, or a reflection of planning that needs to be a little more refined. I do believe some revised NACI guidelines are coming out this evening or maybe tomorrow, but that reality needs to be reflected on the ground. If you're planning for non-Indigenous peoples that are in their 70s and you create that threshold, it's got to be lower for Indigenous peoples because of what the science points to and that vulnerability. This is about protecting people, and the best way to protect people is to follow the science, and that is what we will keep doing at my level, but at the table levels, at the urban Indigenous tables, that we are pushing that and working hard to make sure that provinces implement it. I would note that many provinces are moving in that direction, and again, it's a function of scarcity of resources in terms of the actual vaccine. It's also a function of the as much as it is the deployment priorities. And so as scarcity continues, ensuring that those people that are the most vulnerable get protected first is key to what we believe is an equitable healthcare system. And you asked again a second question as to what we have within our power. We will do absolutely everything to make sure people are protected in Canada, and this isn't a jurisdictional battle. I do note the effective limit of the federal government's jurisdiction in urban settings in healthcare systems is indeed limited, but it doesn't prevent us from continuing to advocate that Indigenous peoples be properly reflected in the planning and rollout of principally the larger rollout in phase 2.
Zach, do you have a follow-up?
Yes, I do. Minister, you said it was a reflection of the plan that used to be a little more refined. That seems to me like a very long-winded way of saying that you think Saskatchewan made a mistake. Do you think Saskatchewan's government made this mistake out of a scarcity of means and those pressures, or do you think there was a lack of consultation there?
I haven't read the plan yet, and so I want to take a look at it myself. You're telling me about as much as I already know. And so I want to see what the plan says, and then have that discussion with them at the tables that we have that are very well developed, and have been relatively successful in establishing those priorities. So I won't draw that conclusion yet. I think it's we're all fighting a pandemic and doing the best within our capacities to do so. But from where I sit and from where we sit at Indigenous Services Canada and the Government of Canada, we'll keep pushing to ensure that Indigenous peoples are properly served regardless of where they live.
Thanks, Zach. We'll now take questions from the room. Would you like to go ahead?
Hello, Mr. Miller. My name is Mal Hamidi. I'm with the Canadian Press. I want to ask you about a bit of a different topic here. The government introduced Bill C-15 in December to implement the UN Declaration on the Rights of Indigenous Peoples into Canadian law. Do you think the implementation of the UN Declaration will help in fighting systemic racism in Canada? And if yes, how?
Well, you just need... Thanks, Man. You just jumping right into your answer. You just need to read the declaration. As Wilton Littlechild has said, it puts Indigenous peoples on the starting line for once. These are principles, they're declarations. The hard work with the declaration is then ensuring that our laws reflect that, and that's a tougher long-term task. And it's a task that sits squarely with the federal government, but always as well as with the provinces as they reform their laws. And we've seen the work and challenges that BC has faced. But it is not an uncomplicated set of declarations to put into effect. And I think that's when people get frustrated with the lack of progress, they point to what needs to be done in the long term, and not simply passing a law that is highly symbolic, but sets forth a set of principles as a guiding light as to how to guide our behavior with Indigenous peoples on an equal footing. And so you can identify multiple instances of where that isn't the case and continues not to be the case. And that's the longer term reflection that I think a lot of leadership has to jump into ensuring that that those principles stick. The UNDRIP falls squarely within the language of rights and equality and self-determination, principles that Indigenous peoples have had to fight for and often had to go to court and then wait 20 years to see them implemented on the ground. And so that is a continuing struggle that we'll all face as a nation and as Canadians. And then you look at some of the things I hear about treaty rights and Section 35 of the Constitution. So it isn't an uncomplicated topic to address in a press conference, man, but a very important one, because it is as Wilton Littlechild said, putting Indigenous peoples finally at the same starting line, knowing that the finish line is still very far away.
I mean, related to this topic or two, I would also like to hear your vision on how the implementation of the UN Declaration will help Canada to move beyond the Indian Act. You said before that that's the ultimate goal at some point. That should be the goal. How is this going to bring us, more closer to move beyond the Indian Act?
Well, the Indian Act is a colonial instrument that's highly discriminatory, and it is probably one of the areas that will be the most intense point of focus moving forward with Indigenous communities. What UNDRIP says and what any form of having social relations with anyone dictates to us is you got to listen to the other side. You got to have conversations with communities in how they see their governance going forward. The Canadian government, in some circumstances, has been complicit in destroying governance structures that have existed for hundreds of years, highly sophisticated ones, and implemented a system that, while it is still there, is one that will take time to reform. So you have a set of principles under UNDRIP. You have treaties that are sacred, that have not been respected. These are all very, very complex conversations that most likely will not be public over the next few years. Minister Bennett, as you know, and supported by Minister Lametti as we reform policies that guide our relationship with Indigenous peoples, have started to go down that road with recognition tables. However imperfect they are, they have led to a recognition that we need to start working with each other and not imposing everything from Ottawa. So you ask what my opinion is. My opinion will depend on what I hear. That may be uncomfortable for a politician to say, but it's very important in how we relate. And what we hear from coast to coast to coast are different narratives, and they're important to hear, important to recognize, and very important to hear from the people that are advancing them, and not less people like me.
Thanks, Man. Next question.
Good afternoon, Olivia Stefanovich, CBC News. I'm looking for an update on whether delays with the Moderna vaccine shipment will impact the rollout in Indigenous communities, because we're hearing from health professionals in Alberta. I spoke to Dr. Lana Potts last week, who was concerned that she just doesn't know when vaccines are going to be rolling out to her nation, to people in her nation. And I'm wondering what is going on here. Are we seeing delays, or is this a case of the Kenney government ignoring the vaccine needs of First Nations?
I think at this juncture, Olivia, it's hard to draw any broad conclusions. From what I understand to be Dr. Potts's legitimate criticism, I think was the result of sort of the unnatural fault lines that are being created as we deploy vaccines, the Moderna one principally because of its handling, into northern and remote communities, and more proximate communities that, while they display essentially the same type of vulnerability by virtue of the fact that they lie a little closer to an urban set to the vaccines, that's a sort of a function of, it's a function of the limited global undersupply, but the limited supply under Q1 in Canada. Now, we've made northern and remote, I guess, quote unquote, communities a priority, but with those unnatural fault lines that follow. You see the same thing in Northern Ontario with some communities that perhaps have road access to an urban center, so they don't get that level of priority. It isn't a question of whether that, of a community being pitted in against another community, but as time rolls on, if you're a leader in that community, you legitimately say to yourself, my community is just as vulnerable as community Y. How come I'm not getting, how come my community members aren't getting the vaccines in a timely and expeditious fashion? I think a lot of this is solved. I think a lot of this is solved through in the next few weeks and months as we look at some of the increased mobility of the Pfizer vaccine. Frankly, you've drawn the interplay between the sort of the more flexible approach to getting Moderna out to northern communities and Pfizer being perceived as being less accessible to Indigenous communities in the north. But that isn't necessarily the case in more southern communities and ones that are closer to urban centers. So increased deployment of the Pfizer vaccine, that means the procurement with the ultra low temperature freezers and the proper needles to the ultra low that we've been talking about for ages to get the 6 doses out of the Pfizer flask. But those are all ongoing conversations that we're having at the table with leadership in Alberta in this case, but across the country. Alberta's guidelines have been generally pretty respectful with respect to how Indigenous communities are being prioritized. A lot of the challenges happen with the operationalization of that. So quite early, they got a lot of vaccines into the long-term care facilities, but drawing that nuance out between the fact that a long-term care facility, the fact that there aren't that many in Indigenous communities, and one in non-Indigenous communities, it's not an apple-to-apples consideration. So there's a lot of folds to your argument. I would hesitate to to point fingers and call things out at this time. My real concern is with if that isn't happening in real time when we have larger volume. I've got a problem with that. I've also got a problem if we don't have that nuance with respect to urban communities being reflected in some of the prioritization. And I think all Canadians would have a problem with that because that vulnerability is there, and we need to address it, particularly in a landscape of low volume of the vaccine. So a lot of answers to what seemed like a direct question, but it's important to draw that out.
Thank you. On another topic, we are approaching 2 years since the National Inquiry into Missing and Murdered Indigenous Women and Girls released their final report. Can you say definitively if your government will release a national action plan this year? Can we expect that?
There is a lot of moving parts to answering that question. Again, I'll paraphrase Minister Bennett. It is not a federal action plan; it's a national action plan. So it's a function of the reports we're getting in from Indigenous communities, leadership, national organizations, and our sense of when the right time is to get it out. And we're proud of the work that we've done. A lot of it, we've already announced a bunch of initiatives, including the shelters a little over 2 weeks ago for Pauktatit, which is one of their main recommendations to protect Indigenous women and children. This is it's part of a multi-pronged plan in terms of what we're doing, but I know people are eager to see the national response. But it's also important to note that there has been a lot that's been done up to now, but I think in respect, first and foremost, of the women, they want to see something that we can all be proud of. I'm confident, but I can't speak publicly as to a specific date right now.
No timeline really yet on when this plan is going to be released.
Like I said, I'm confident that we can get something out in relatively short order, but I can't commit to a timeline.
Hi, Minister. Chris Nashkate, CTV News. What do you say to grassroots people right now who are talking about UNDRIP and Bill C-15? They're instead calling it CAN-DRIP. And saying that they're laying the documents side by side and saying it's apparent CAN-DRIP finishes the work started by John MacDonald and Duncan Campbell Scott. Bill C-15 with recolonize and not decolonize. What do you say to grassroots people who are starting that conversation on social media right now?
Look, Chris, and I have a lot of respect for people that have views that I don't necessarily agree with. I know how long it took for Canada to even say we were going to be part of this, and it took a long time. A lot of the national organizations have been advocating this forever and holding our feet to the fire, and rightly so. I know the work that someone I respect immensely in Romeo Saganash put into this. The emotional investment, physical investment that he put into it. And I know the work that all parties, most parties have done in convincing their own people that this is the right way to go. There's no doubt that there's still a lot of political capital to be built on the backs of Indigenous peoples in this country and bringing them down and stoking intolerance. And UNDRIP is a way of ensuring that there are some guiding principles around some very, very basic premises in terms of equality, language of rights, respect for self-determination. It is a Canadian law. I've heard the criticism that that Section 35 would be above it. If you talk to some treaty people and some of the numbered treaty leadership, they are very worried about their treaties, which they hold sacred, falling under UNDRIP, which isn't the case. Section 35 makes them prime, but the UNDRIP is a set of mechanisms to hold us to account, the government of Canada to account to ensure that we're properly serving Indigenous peoples and that we're respecting the honor of the Crown, which is a concept that goes back to the Royal Proclamation, so way before the Constitution. It's imperfect. It'll take a lot of work within government. You know, when you say grassroots, I think there's sort of perhaps a false parallel with the youth, but there is pushed a lot by a youth movement that is increasingly vocal, and it's very important to listen to them and to not substitute my views for them. So I listen to them, but I think that by speaking and talking and getting together and talking about these issues, talking about what some of those rights are, you do come to some common thinking and sometimes of one mind. But it isn't. These aren't easy conversations. I mean, these are conversations that I was having in a different forum almost exactly a year ago at Tyendinaga about non-respect of treaties, respect of treaties embodied in wampum. These are conversations that we haven't had as a country, as a leadership for some long time, and I believe UNDRIP contributes to that conversation. But it is getting UNDRIP into law is an immensely important first step, but it is very much a first step, and that's sort of my longer response to that. But it's important to let those people speak, I think.
Thanks, Kristen. This concludes today's press conference. Ceci met fin à la conférence de presse. Merci.
Thank you.